The hip joint is a ball and socket joint that allows motion and gives stability needed to bear body weight. The hip is one of the most stable joints in the body, but because it bears your body weight, it is more likely to develop problems because of the extra pressure leading to hip replacement. Dr. Joseph Assini is a board-certified, fellowship-trained orthopedic surgeon and tells us about the latest approach to hip surgery.
My practice focuses mainly on replacement of hip and knee and revision of those joints that have not gone well. So the number one symptom that I would be seeing would be osteoarthritis. Arthritis is a kind of a catch-all term for just inflammation of a joint. It can be caused through injury, it could be because people have aged, they have active lifestyle. We also have inflammatory arthritis, and those are things like rheumatoid or psoriatic arthritis. All of those eventually just lead to destruction of the joint architecture. And at the end of the day, if you failed your medical treatments or your conservative treatments, then most people are leaning towards joint replacement, and that's where we would come in. So typically when I first meet a patient, the first thing I want to get an idea of is what their goals are. So for different patients, those are different things. So some patients, their goal is to complete 18 holes of golf. For other patients, it's that they don't want pain when they're at the grocery store. And from there, we can develop a treatment plan that would work best for them. Joint replacement has become very successful over the last 15, 20 years. The materials have gotten better, the techniques that we use have improved. And I would say now about 70% of my patients are going home the same day of their surgery. So for me, a rapid recovery total joint is something that I have a lot of passion for. And when we say rapid recovery, that's individualized to a patient. So some patients, that's 3 or 4 hours, they're up and out the door. Other patients, that's one night stay in the hospital until they're ready to go home. So we can tailor that program for you as best as possible. Hip replacement, not a new surgery. It's been around for a really long time, and it is probably the most successful medical procedure that we have in the history of medicine. What's changed recently is how we do the hip surgery. So initially hip surgery was done, or hip replacement surgery was done through big incisions, really opening up the body to see everything. Minimally invasive surgery started to come around. The problem with the minimally invasive surgery is that if the surgeon can't see very well, they can't put the implants in a really good position. And putting implants in a good position, especially on a hip replacement, is of the utmost importance. With an anterior-based surgery, which is probably becoming one of the most popular ways of doing surgery, it can be hard to visualize. And secondarily, the incision is done in a way that it's in line with the femur, so up and down. And this sometimes has some trouble healing. And if you have a wound that is not healing as well, or healing issues, that can increase your risk for infection. Okay, so we've thought of an idea where we change the orientation of these incisions, so we make it flatter, so basically we call it along your bikini line, or transverse-based incision. The idea behind that is it's now made in line with the healing of your normal skin. So we're not cutting against those lines. The second problem with is visualization, like I mentioned, so we have healing and visualization, is that we adapted a portal, which is a small tube. It's about as big around as a Bic pen, and we use a special instrument to insert that through the patient's thigh. It makes a very small stab wound. And now we can prepare our socket through the cannula, which allows us to see much better. So instead of having big instruments and reamers, we call them, to prepare the socket through that small incision, we actually put them through the cannula so I can see much better. So we have our healing benefit and we have our visualization benefit. The third benefit that we've been seeing from this is that the patients are experiencing much less numbness. So unfortunately when you do an anterior hip surgery, we encounter some nerves, and this can give patients numbness on their thigh, and it can be bothersome for about 20% of people. In the study that we're running right now, we're seeing very low rates of numbness in these patients, and I think it's because of the orientation of the incision. So our visualization, our healing, and we think numbness are improved with this anterior path procedure. So I developed it with 5 other surgeons across the country. We've been doing it since 2019. We have a large database, and we're about to start publishing our first research data points on it. And we presented it sort of really all over the world. It's been presented now. So I think it's growing in its use, but I have to say I'm still the only one locally in Colorado that's doing it. And I think our patients are really happy with the procedure.
Dr. Assini's practice specializes in hip and knee replacement and the revision of failed or painful hip or knee implants. One of Dr. Assini's main focuses is on rapid recovery total joint replacement, which strives to get patients back to full function as quickly as possible.